try to record. Okay, so let me share my screen. So post your question at each slide. If you have any. Okay. 자, 안녕하세요. 저는 정의현이고 여러분들의 오늘 약 3주에 걸쳐서 여러분들과 같이 강의를 맡게 됐습니다. 다들 만나서 반갑고 이렇게 얼굴 보게 돼서 반갑고요. 여기 저희가 이렇게 전달해 드리고자 하는 내용이 굉장히 터미널로지가 많이 나와요. 그래서 이게 Medicine is a language. 그래서 여러분들이 새로운 터미널로지를 잘 익숙해져야 되고 그런 것들을 되도록 가능하면 제가 설명을 드릴 텐데 제가 영어를 쓰다가 우리말을 쓰면 전달이 조금 더 빨라지기는 하되 터미널로지는 대부분 영어이기 때문에 그래도 뭐 쉽지는 않을 것 같아요. 근데 이제 보통은 제가 다 맡아서 수업을 하면 한 번씩 계속 퀘션을 받아서 그 다음 시간에 설명을 하고 이런 식으로 진행이 되는데 이번에는 이렇게 연결해서 하지 않고 약간 끊어지기 때문에 이번 수업 시간에 한 슬라이드 끝나고 나면 여러분들이 채팅창에 질문을 던져 놓으시면 한 슬라이드에 한두 개씩은 제가 질문을 받고 답을 하고 또 넘어가고 그런 식으로 진행을 하려고 합니다. 이 부분에 대해서는 또 피드백을 주시면 될 것 같고요. 자, 그럼 제가 채팅창을 잠시만요. 채팅창을 놓고 여러분들의 질문도 한꺼번에 좀 볼 수 있도록 하려고 합니다. 자, 오케이. Let's see. So today, lecture 5, I will discuss about part 2, diagnostic devices. First, I want to examine the circulatory system, including the characteristics of blood pressure, blood oxygen, blood gases, and blood flow. I know that you guys have already studied this, but I want to briefly review the heart. So we have a heart, not at the left side, but at the middle of your chest. So we have right atrium or 우심방. So there comes the blood throughout our system, and then this blood goes down to right ventricle, which is 우심실, and this blood is coming from all over your body, so it's deoxygenated. And that blood has to go to lungs, so that we send out the blood to the lungs. Here I want to emphasize the definition of artery and vein. Artery means the blood coming from the heart to outside. So this is artery, and lungs in English is a pulmonary, so it's pulmonary artery. While lungs will oxygenate the blood, and that oxygenated blood will come back to the left atrium. So this direction outside to the heart is a vein, okay? So that left atrium, which is fully oxygenated, and it goes down to left ventricle, which is the biggest part of our heart and the thickest wall because it's a real pump. Okay, that left ventricle or 좌심실 will send out blood throughout the body, and that goes to so-called aorta. And aorta is the first big artery, which you see many branches. Some part goes to the head, or the other part goes to the rest of the body. Okay, and then the rest of the body will will perfuse organs, 모든 기관들에 갔다가 and deoxygenate it, and then they goes back to the right atrium. So that's the basics. I want you to remember these terminologies. Let me go a little bit of more of a real names. So how does the blood get into back to the heart, which is right atrium? And that's based on so-called vena cava, 대정맥 in Korean. And it has two directions because blood coming from top to heart, bottom to the heart. So that's superior versus inferior. So there's two channels going into the right atrium, and then it goes right ventricle with the presence of heart valve. It's a little difficult term for you, tricuspid valve. We'll get into this later on when you're maybe in graduate school or getting into the more deeper level. And the right ventricle, we push this one to the lung. So to oxygenate blood through the lung is, I said, pulmonary. So that's why the valve name is pulmonary valve. So it goes to right and left lungs, and then it will be oxygenated and come back to the left atrium, 좌심방. Here, very interesting and notable thing is, you see this is artery, but the pulmonary artery has a low oxygen. So it's deoxygenated, even if it's artery, which is contrary to our normal conception that arterial blood is oxygenated, venous blood is deoxygenated. No, not true in this case. Pulmonary artery deoxygenated. After oxygenated, it comes back to the heart through pulmonary vein. And this is oxygenated. So that's something you have to note. And left atrium to left ventricle, there's a special name of the valve called mitral valve. I don't still remember which is which, but for you, at least once you have to know and understand. And it goes to aorta, that's why through this aortic valve. Hopefully this name nomenclature makes sense to you. Questions? Question to you can ask question every slide, okay? I'll wait a little bit. If you don't have question, I'll move on. So you guys know everything here? 질문은 우리말로 적어도 돼요. 편하게 하세요. 자, 그럼 넘어갑니다. 더 어려운 것들이 또 뒤에 있을 수도 있으니까. Okay, now let's think about the vascular system. So you guys, we are an engineer. Let's say we want to design our system. So human is a vertebrate. 우린 척추동물이에요. And we have multicellular organs. So each organ has to be perfused with oxygenated blood. And how are we going to design our vessel system to perfuse, send out oxygen throughout every cell, and then collect all the waste and CO2 and back to the lungs so that we can reutilize and circulate. So for that, we design our vascular system as a closed loop system so that the blood is always inside blood vessel and the heart. And the fastest way to move oxygen and nutrient from our heart to throughout the body turns out to be convection system. You guys may remember what diffusion is. Diffusion is very fast exchange of molecules within very narrow, short distance, such as inside a cell, okay? However, when the distance gets longer and longer, it is extremely difficult to diffuse out a molecular transport from one to the other, such as you don't smell your, like, you know, the bathroom smell if you are 10 meters away, okay? But because of that, we develop a system of circulation which efficiently pass one part to the other part. So this is a model of vascular system. I'm only talking about blood, not the lymphatic, which is also another fascinating system, especially for our immune function. But we are limiting ourselves to blood vasculature system. And here you want to see the architecture. From the heart, that aorta is about 2-3 centimeter diameter, which is huge, okay? Because the heart is pumping, and that gets down to the artery. And artery, small artery, is named as arteriole. So you have to remember this. And the first order arteriole, radius 30 micron, which means tiny, okay? Very small, tiny, but that's not tiny enough. We want to branch out second order, third order, fourth order, until we get down to the capillary. Capillary, you have to understand, look at this diameter, 3 micron. Don't trust this number too much. This is textbook name. You have to, when you look under the microscope, this can be different, okay? But look at the general dimension. It's about several micron. And what's the diameter of RBC, red blood cell? So that's a disc, and that diameter is about 7 to 8 micron. Look at this. This is much smaller than one RBC diameter. What it means is RBCs has to pass through. It has to deform, not this disc shape, but it has to deform through this capillary during the time it actually exchanges oxygen, nutrients, oxygen, and getting back to the CO2 to the blood plasma. And this composes of the business end of our circulatory system, which provides oxygen and nutrients and collect CO2. That's what's happening in capillaries. I think I read capillary length for one human is longer than from the earth to like the moon, which is just amazingly long part. And then you have to collect. And during the time, our heart is pumping hard to push with a pressure-based movement. But when it gets down to the vein side, which is 정맥, so like arterial, 세정맥 is called the venular. Even smaller one is called, it's a venular, okay? Arterial and venular. And so it gets down, collected each other, fourth order, third order, second order, first order, venular. And this part is so-called venous collection system. And that is connected through the heart to form a circuit, closed circuit. Okay, a good depiction of this system is we have to see, hey, our circulation system has a driving force, that's heart. What does the heart do? It generates pressure gradient. That is driving force. So when you look at it, pressure millimeter Hg, it's 100 millimeter Hg. It's very high in this aorta. Large arteries, small arteries, and then it gets down to the arterial. And this is a cartoon showing that the heart is pumping. So the pulsation is there. While pulsation gets down, and you look at capillaries, the pressure gets very, very low, and it's almost zero in the lungs. And when it's collected to 대정맥, vena cava, and then it goes back to the lungs, and this is pulmonary artery. There's a little bit more pulsation because that's a pulmonary artery and goes down capillary. Okay, hopefully this is a systemic circulation. This is pulmonary circulation. Okay, so any questions in this slide? You can write down any questions. I may go back to check and like to explain you further. Okay. So you're free to ask any question. Okay, it's important for me to understand what you understand, what you don't understand. Okay. All right. So let's go through a little bit of the this circulatory system blood pressure. So blood pressure, most commonly measured vital sign, a physical parameter. So when you are sick, going to the hospital, the doctors will first check your vital sign, which means the most important parameter, physiological parameter, to see whether you are healthy or you are what kind of issues you have. So the most important thing is the blood pressure. And why? The pressure is defined as by blood on the vessel walls in the circulatory system. And that pressure measurement will vary over time and locations in the system. Over time, especially heart and artery, it pulsates. You guys know your heart is beating, and that's the pressure waves. And locations, whether it's artery or vein, the pressures are changing. I just showed you before. And BP is generally modified by various normal and abnormal physiological conditions. So this is very important, especially when you are in coma, in the shock state, okay? Let's say diabetic coma, and your pressure is not high enough, that will not give enough blood flow to your brain, and you will get down to the coma state. Okay, so in that regard, blood pressure is very important, especially low blood pressure can be more dangerous, okay? So from cyclic pumping of the heart, blood pressure varies with highest value at the point of maximal cardiac output falling to low value. So what it means is think about the heart as a pump. You squeeze the heart, that time the pressure goes up, and then you dilate, pressure goes down. And hopefully it makes sense to you, because pressure is just a dynamic kinetic movement of molecules within a confined space. You push, then there's more density, there's high pressure, then you dilate. And there's a specific term for this called systolic blood pressure and diastolic blood pressure. So the maximum arterial pressure, lowest pressure. And we want to say in one word, hey, I want to make a mean. So mean arterial pressure, or MAP. Okay, before I go there, next, I want to emphasize, you already learned about the concept of cardiac output. So our heart is the most important. So the output of the heart is called cardiac output. For normal people, normal adults, usually think about it, 5 liters of blood per minute. So heart is really working hard, 24/7, 365 days. And so just remember this number. In 1 minute, we push about 5 liters of blood, okay, by the heart. And I want you to at least have some of I want you to at least remember some of the numbers, which is useful because you take your blood pressure at the 학생회관, right? How many of you have actually taken your blood pressure? Raise your hands. Oh, not many? Yeah, it's free. Okay. Yeah. Please, after this class, make sure you measure once. This is very, very important to know yourself, okay? So systolic blood pressure is supposed to be lower than, the unit is milli Hg, and diastolic is lower than 80. So 80, 120 is a very important number to remember. And another number you want to remember is 140, because this is higher than this, you are supposed to be hypertension or 고혈압. So you have to be very, very careful if you find yourself or your family has a history of hypertension, because this is one of the most important parameters you have to see about your health, your cardiac health. Okay, so 180 diastolic is of course lower than that, and high blood pressure called hypertension, 140 is the most important. And some people has very high, especially if you have a family history, genetic cause, you gotta be very careful, go to see doctor and have a preventive, even taking drugs. In my case, I have systolic pressure only 90, diastolic only 60, which is markedly low because I'm pretty thin. And why am I not to worry about myself? Because of this data. It's very interesting data. You see over ages, blood pressure will always goes up. So look at normal range, pre-hypertension and hypertension. So I'm sure over time, my blood pressure will goes up. So I won't be as much worried if I'm here because I'm lower than this. Probably later I'll be still normal. That's my interpretation. Okay, so please check yourself. And it would be good to know, so what does it matter if I have hypertension or 고혈압? Okay. There's a list of diseases which we have to be worried. So the most important organ in our body is a brain. Hey, cerebrovascular accident, CVA, or people say stroke. In Korean, 뇌졸중. You guys have like people around 풍 맞았다, 풍에 걸렸다, 반신불수가 됐다. You hear about this, many Koreans get this. Hypertension is a high risk factor. Encephalopathy, very complicated term, but what encephal means brain, head. Apathy, here you retinopathy. So apathy, what I say is 아팠지. 너 아팠지. Actually, 아픈 것 is apathy, okay? Encephalopathy, yeah, disease. Confusion, 혼란, okay? Headache, 두통. Conversion, 경련, 발작, okay? So all this can happen with hypertension. Retina, our eye spends a lot of energy, it needs a lot of vascular perfusion. Hypertension makes our vessels in our retina, 망막, vulnerable. So you can get retinopathy. So gotta be very careful not to lose our vision. Blood, somehow hypertension is linked to diabetes, 당뇨병, high elevated blood sugar. Okay. Heart, the most important like killer in Western society is 심장마비. Okay, that's, you have to know this term when you want to communicate with the doctor. They call MI, or myocardial infarction. It's very difficult term at first, but myo means muscle, cardio means heart, infarct is in Korean 경색, which means the blockage of blood vessel to cause the tissue to die. Okay, in Korean it's 경색. Very important, but normal lay people will say heart attack, 심장마비. So most of the time 심장마비 means MI, myocardial infarction, and hypertension is likely to give cardiomyopathy. What it means, heart muscle 아팠어. Okay, of course it gives a heart failure. And kidney is an amazing organ, and I think in 1 minute or 1 day, or around 1,000 liters is being filtered. I think it's 1 minute. 1,000 liters is filtered. It's a heavy duty organ, very important. Our hypertension can damage kidney. So nephro means kidney, nephropathy. 심장이 아팠어, 콩팥이 아팠죠. Okay, nephropathy. Okay. Or chronic renal failure, 만성 신장 failure. Okay, so you may need a 투석, 심장 투석, dialysis. Okay, so many complications. So you don't want to get this hypertension ahead of the time, hopefully. So I want to explain between, okay, before, let me get any questions for you. So I'll give you 10 seconds. You can write down your questions so far. And if you cannot hear me well, let me know too. Okay. You can send me private message if you can't hear, or if things are too fast, you can tell me, or my English is bad, then you can tell me just to use Korean. Okay, so there are some questions. Second slide graph. Okay, let me go back. I guess you're talking about this graph. Let me see. Minso, raise your hands, Minso. Okay, this graph.
밑에 있는 거예요. 네.
Okay. Yeah, this is actually not easy to understand. But let me go back to this. Maybe go back to here. I think it's important to know the order. So let's start with left ventricle, which is the highest pressure. It's pressure giving aorta, that's highest. And then aorta send out blood to upper brain, lower liver, or the rest of the body. And then they get down to the artery, arterial, and capillary. Capillary is 모세혈관. And then, you know, they will be collected by the venule, 세정맥, and then going back to collected, and eventually they come back to vena cava, okay? And then they come to right atrium, right ventricle. These are deoxygenated blood. And then you send out this to pulmonary artery. So this right ventricle is also pumping. So that's why there will be another pulsation adding up, and then pulmonary artery, and they go through the lung, the same as artery, arterial, lung capillary, lung venous, lung vein, come back as pulmonary vein. So with that in mind, sorry, I want to go through one more time. Aorta, this is the highest pressure, large arteries, small arteries, arterial. So now we are getting down to all the organs throughout the body, capillary, vein. Still there's some pressure, so they will be pushing blood. But after the vein, you see it's almost zero. So vein, blood cannot go by themselves. And that's why we have a 판막 valves in the vein, and so that they don't go back. It's a very important function. And then come back to the large 대정맥, vena cava, and go back to the pulmonary. It's not as high as this. So that means right ventricle is not as muscular as left ventricle, because left ventricle send out blood throughout the body. Right only need to send blood to our lungs, nearby lungs, so that it doesn't have to be very high, but it pulsates because it's artery. Again, through the lung arterial, lung capillary, lung venous, and pulmonary vein. Does it make sense? Yeah, hopefully this will explain you. Okay.
네, 감사합니다.
Okay. 고혈압과 보통 혈압을 나누는 기준. Very good question. So, yeah, normal, pre-hypertension, hypertension. That's a very good question. You know, so far our medicine is about data. So we distinguish, hey, about 120 millimilli Hg lower, we consider generally normal, and diastolic normal. And pre-hyper, over 140, we call it stage 1 to hypertension. However, regarding to this question by Jung-hyuk, this is a general so-called normal range. All humans have different shape, size, and we want to fit into here just for convenience. I would say this is for convenience, but now we are in the time that, like me, who are thin, small. For me, maybe normal range is maybe even lower. For some people who has a much bigger stature, they may need to adjust. So that's n equal 1 data. If you have a data collection throughout, then we can have a personalized criterion for this instead of this general public population based. So I just want to emphasize this is just like so far we use this, but in the future I'm pretty sure we will go to data log for personalized measurement, so that like even I'm on 144, I might not be hypertension. It's totally possible. Okay, and I hope this one answers your question. So let me go to this. So, okay, did I answer all the questions? voltage large 들어갈 때 let me go back a little bit. Sorry. aorta에서 large. aorta에서 large 갈 때 okay. It's a very good question. Why this amplitude seems to be high? Honestly, I do not know the answer, and I'm not even sure that's actually true or not. This is in fact cartoon because this axis is not time. So this is kind of showing you to understand. So sorry, I do not know whether this is true or not. Even if it's true, maybe I do not know the answer clearly here. Okay, but yeah, I love the question which I cannot answer. Okay, that's the most important. And let's go move on. Hypertension and hypotension. Normal blood pressure systolic 120, diastolic 80 millimilli Hg. And 고혈압 is defined as increased blood pressure. Systolic blood pressure, diastolic is higher than 140 and 90. Then we define it as a 고혈압 or hypertension. Why these things happen? Renal system, renal kidney has a sensor to measure blood pressure. So that's very sensitive. And if that system problem can cause abnormal autonomic nervous system, 자율신경계 이상. Okay. And persistent hypertension, 지속되는 고혈압은 can cause strokes, 뇌졸중, aneurysm. This is a very difficult term, but you have to know this because even my friend died of this, okay? And kidney failure, because kidney is a very sensitive organ, and other cardiovascular disease, such as 동맥경화증, atherosclerosis. I'll talk about it. I'm going to explain your aneurysm first. So my friend's dad almost died from this. Aneurysm is a blood vessel, especially artery, bulge. So artery wall, for some reason, such as atherosclerosis or something, vessel wall become weakened, and weakened artery has high blood pressure, so it becomes bulge. So it goes like this. And then it's at the risk of rupture, but artery rupture, it can happen in the brain that we call hemorrhage, 뇌출혈, or inside our body. So aorta wall can go ballooning higher. And if we didn't find it before, once it ruptures, patient die in a minute, okay? Because there's a huge bleeding. Okay, that's why it's important, but now we have a better medical imaging technique can detect this earlier, and we can do preventive, procedure. So that's why it's very important to know about this. And people say hypotension or 저혈압. It's defined as a very low blood pressure, even lower than 65 millimilli Hg. Why 저혈압 matters? Because if it's too low pressure, it cannot pump high enough blood to the brain to perfuse. The brain is spending almost 20% of oxygen, and if you don't perfuse enough, you start to lose your consciousness, and it can be dangerous. That's why people say hypotension can be dangerous. why it happens, autonomous nervous 자율신경계가 이상, or blood loss, especially when we, from accident, we lose our blood. Loss of blood volume causes lowering of blood pressure, okay? Or even infection, 감염, toxin, 독, hormonal imbalances, okay? So what it means is reduced perfusion. Perfusion is, giving this perfusion is giving this oxygen nutrient to the organ or through the canal or blood vessel, most significant to the brain. Brain's the most important at that aspect. And we understand this as a physiological state, 생리적인 상태, rather than a disease. 저혈압을 병이라고 하기보다는 어떤 상태가 됐을 때, 저혈압 상태, 그러면 위험하다라고 하는 거예요. So, reduce cognitive function, 제대로 정신이 오락가락하거나 dizziness, 혼미하거나 unconsciousness, 의식을 잃어버리거나 그러면 eventually death. So that's why hypotension it's also very important. Okay, any question? Let me see. Oh, good question. I think, okay, the question of this is, I believe it's higher. Let me go back. Oh, sorry. Yeah, look at that. Yeah, this is only showing normal. Sorry, I don't have the clue for that, but I believe this systolic blood pressure is lower than 65. It's a dangerous state, so it's 저혈압. That's what I believe. I'm not a cardiologist, so I don't remember all the numbers by myself. But if I'm wrong, let me know later on, which will be good. So high blood pressure effect on the heart. So high blood pressure is a sign of the heart. Something's wrong and blood vessels are being overworked because it pushes maybe too hard. And this can lead to atherosclerosis, very difficult to pronounce, okay? And congestive heart failure. Yeah, so heart failure can lead, and you see the heart size can burst, enlarge the heart. And here I want you to look at this atherosclerosis, which is one of the top killers in Western society now in Korea. Many people are dying from the heart because of this. The blood vessel on the heart, atherosclerosis, 죽상 동맥경화증. And let me show an example of this. So what happens? So these fatty, 지방질의 침착이 생기면 캐로티다리, 경동맥에 이런 게 생겨가지고 이게 점점 브레인으로 가는 피를 막아요. 그러다가 어떤 순간에 딱 터져. 그럼 어떻게 되냐? 피는 뭔가 상처를 받으면 혈관에 굳어버려요. 여기 막히고 브레인으로 가는 피가 못 가니까 넘어가서 죽게 될 수 있는 거죠. So that's an example of atherosclerotic plague from a carotid artery. carotid artery, 경동맥. 전부 이렇게 목에 한번 손대 보세요. 뛰는 게 있는지. 펄스. 느껴지죠? 싸움할 때 목 조르는 거. 그러면 넘어가는 거지. That's this one. Okay, I'm going to show you this as a 경동맥. So we have two carotid artery, 경동맥, but they look like this. A simple form, V shape. Why? One, we call it carotid artery, common, and then it splits. One goes to outside of face. So when we change our face, all the vessels are coming from external carotid artery. Okay, face, scalp, 두피, and neck. That may not be as important as inside because there's internal carotid artery going down in and inside, so feed your brain. So this is very, very important. And that artery is what you can feel the pulsation. This is normal, but 유체역학적으로 아주 재밌게도 이런 플라그가 여기에 잘 생겨요. 이게 bifurcation이라고 하는데 유체역학적으로 분명히 뭔가가 작용하고 있다고 볼 수 있고, 예를 들어 turbulent flow here, then narrowing down of blood will cause turbulence. What it means is, you know, like the flow has two kinds. One is a very smooth layered flow we call 층류, and the other is like mixing up, making eddy, called 난류 or turbulence. And this will cause turbulence, and we use that turbulence to listen. By using 청진기, we can actually detect this. Now we are using ultrasound, even do this job easier. Okay, so that's 경동맥. Okay, so a question of a, okay, here's the question. 동맥류. 동맥류 is an aneurysm. Oh, sorry, 동맥류 is an aneurysm. Can you see this, by the way? Can you see? Oh, maybe not. Okay, it's a question. Aneurysm is a wall of artery is a weakened. Yeah, I think 홍창표, who is 홍창표? Okay, 창표 ask a question. 동맥류는 동맥벽이 약화된 상태를 말하는 건가요? 맞습니다. 그리고 그 상황에서 지속적으로 높은 압력, 즉 동맥이니까 가해졌을 때 혈관이 터져서 출혈이 일어난 상태. 맞고 출혈이 일어나지 않은 상태도 동맥류라고 말할 것 같아요. 출혈이 일어나면 이미 헤모리지. 그거는 이미 액시던트고 굉장히 위험한 상태죠. 이민서가 질문한 플레이그의 개념과 블러드 클래스에 대한 건데 조금 다릅니다. 설명을 해드릴게요. Hey, here's a plague, okay? Let me go move on. Plague. So this term is very complicated. I had a long time to understand this. Atherosclerosis. Sclerosis means hardening, 딱딱해지는 거. Athero is specific term called atheroma. So it's actually pretty hard to understand, but I want to show this. This is normal artery, normal blood flow. And the issue is when you are eating always fat, bad fat, I guess, all the time, the plaque is accumulated inside of arterial wall and then narrows down of the artery like this. If you learn fluid mechanics, very interesting in the circular, if you have just half of the diameter, the resistance goes 16 times. This is amazing relationship. That means to the same flow, you have to push 16 times higher, which is of course not very possible. That means your flow will be very, very limited. Usually this happens throughout body, but the especially important thing is your heart. Okay, so the question, plaque is not the same as blood clot. This is called plaque, okay? And let me explain a little more, but let's look at this one. We cut this and look at this. Okay, this is a vessel wall, and inside you see these are red blood cells, a lot of red blood cells, probably because this is a blood, but you see this part, which is a pale color, 창백한 색깔, and then even whitish. You know, 지방질은 하얗다. Fatty has whitish color, so that's plaque. Okay. So why this happens? For a long time of long-term hypertension and excess amount of cholesterol, so people doesn't like to ingest too much cholesterol because to prevent this, and this will reduce cardiac perfusion, producing, this is a difficult term I want you to at least know, called angina and heart attack. Okay, so my mom suffers from this, okay? What it looks like is called, when you are a patient, when you walk fast, you start to see pain in your heart, your chest, in fact. And they describe it as 코끼리가 심장을 짓누르는 것 같다 그래요. So that's in fact more proper to angina pectoris. This is medical jargon. You don't have to memorize, but at least angina. And why? Because of this, you have much lower blood flow to the heart. 여러분의 심장은 24시간 일하기 때문에 심장에서 보내는 oxygenated blood가 심장세포도 다시 블러드를 공급해야 돼요. 그게 요거예요. 그 중에 하나, 그게 막히면 심장세포가 피가 안 돌아서 일을 할 수가 없고, 이게 만약에 조금 전에 민서의 질문처럼 플라그가 쌓여서 이게 쌓이면 이게 얇아지고 그 자체가 협심증이란 건데, 협심증으로 죽는 건 아니에요. 하지만 이게 탁 터질 때가 있어. 터지면 바로 블러드 클라딩이 생기는 거예요. 클라딩이 생기면 블러드 클라스의 역할은 피를 응고시켜서 막아버리는 거예요. 이게 막혀. 그러면 다운스트림 심장의 세포가 즉각적으로 사망하는 거예요. 심장세포가 죽게 되고, 죽은 심장세포는 컨트랙션을 못하니까 심장의 일부가, 특히 가장 중요한 레프트 벤트리클이 펄퓨저, 펌핑을 못하면 그걸로 브레인으로 피가 못 가니까, 그래서 뇌사 상태에 빠지고 죽는 거죠. 그렇게 이해를 하면 될 것 같아요. Okay, so, but I want to specify a little bit of a, let me see. So, before moving on, I want to ask, tell your question. 윤만성, 맞지? Okay. 만성이가 아터리, 동맥의 혈류가 빠를 텐데 어떻게 플라그가 축적될 수 있나요? 작은 조각들이 어떻게 같은 위치에 뭉칠 수 있습니까? Okay, very good question, 만성. Yes, but when you look at this, going back. Look at this. Of course, arterial flow is fast, but what matters is this accumulation is underneath of the artery. It's not outside of arterial wall, but underneath of the artery. Why this location? Very good question. I do not have very clear answer, but from fluid mechanical point of view, there are places where this tend to happen more often. A good example is a carotid artery. This part. From fluid mechanics, bifurcating area has a lot more eddy, turbulence formation. When turbulence happens, flow speed is reduced, and probably that differences in flow will affect the cells on the wall of the blood vessel, and I believe that has an effect on this specific location. In the heart, I think similar thing can happen, but I haven't really searched why in the same, probably it's not always the same, but on the heart, there are locations of blood vessel where this tend to happen more often. Very good question, okay? So let me go back to, I want to explain the differences between arteriosclerosis and atherosclerosis. Not many people understand the difference, but it's very confusing, so I want to clarify. Arterial, it's about artery sclerosis, 경화, 동맥 경화증. So literally, 동맥 경화증 is arteriosclerosis. Now, what's the definition? 동맥이 경화되는 거. It's simply like that. Hardening, stiffening, loss of elasticity of walls of arteries. Okay. This is gradually restricts the blood flow. So artery has a lot of elastic. It's elastic because it has to pass cardiac pulse to the next. So it has to be very elastic, but it becomes stiff. It cannot pass this pulse. So that becomes a problem. So it will restrict flow to one organ, and tissues can lead to severe health risk brought by atherosclerosis. 동맥경화증 중에 일부가 atherosclerosis예요. 이건 아테로마성 동맥경화증이라고 specific form. 여기는 뭐가 involve 되냐면 바로 플래그가 생기는 것까지 이야기하는 거예요. 플래그가 accumulate 전에 동맥경화가 시작되는 거예요. 이건 다이어트과 굉장히 관련 있고, 어떤 케이스는 여러분의 genetic genetic component도 관계가 됩니다. The narrowing of artery due to plaque buildup. 뭐 안티플라그 뭐 치약 같은 거 들어본 적 있으세요? 그 치아에 뭐 쌓이는 걸 플라그라 그러거든요. 그래서 저도 궁금해서 플라그가 뭔지 찾아봤더니 small distinct patch or region resulting from local damage or deposition of material, such as fatty deposit on arterial wall that is defined as a atherosclerosis plaque. Okay, why? This is original meaning of plaque. 벽에 갖다 붙이는 거죠. sticky deposit이에요. 뭔가 붙은 거 플라그라 그래요. 그게 입 치아에 붙으면 여기도 플라그라고 하고, 그래 플라그를 없애자고 그러고. 하지만 원래 상 같은 거예요. 이런 뜻도 있지만 이게 혈관 쪽에서 이런 플라그가 생기는 거는 우리가 혈관이 동맥경화가 되고 그 속에서 플라그가 빌드업하면 그거를 특별히 atherosclerosis라 말하는 겁니다. 자, 이게 질문에 대한 답이 됐으면 좋겠습니다. 자, 오케이. If you have further questions, you can use chatting. So let me go to a fun history. For measurement of blood flow, invasive first. It's like about 300 years ago, Stefan Hertz, he, at the time, horses are around. Hey, he want to measure the horse arterial blood pressure. How to measure? It's very fun. You insert a 유리관 into the carotid artery, probably of a horse, and that blood, boom, it goes up, and then measure the height, and you can actually measure the blood pressure, okay? How to measure blood pressure? Let me just go, maybe stop share, let me see. This is a trial for me to have, let me see, stop sharing, and then I want to share my AirPlay, and then let's see, where can I share? Oh, sorry, I want to share. Oh yeah, yeah. Okay. Can you see this? Can you see writing? So you know, like, let me just go back a quick check of, let's say, 1 atmosphere ATM. I don't know, like 760 millimilli. 기억하죠? 760 millimilli Hg가 우리 그 대기압이죠. Okay, that is about 1 ATM. That is about, I think, 10 liter of water. 한 10m 정도 물기둥이 되죠. 이게 그러면 조금 전에 우리가 이야기한 blood pressure 140 by 80이라고 했잖아요. 약 100이라고 해봅시다. 100 mmHg는 100 mmHg는 10m면 이거 나누기 한 8 정도 되니까 약 1. 얼마 미터 정도 되죠. 뭐 블러드나 물이나. 그러니까 우리 말의 목에다가 동맥에다가 유리관을 딱 꽂아 놓으면 뭐 사람 이 정도니까 말이 뭐 이거랑 비슷하거나 좀 높지 않겠어요? 그러면 이 높이가 약 줄잡아 한 2m 정도 되겠죠. Make sense? So that if you measure the height, you can precisely tell what's the blood pressure of the horse. Okay? So hopefully this makes sense. Let me go back to share to the original. Okay. Due to the time constraint, I want to, let me see. We have about 20 more minutes. So I want to go back quick here. Okay, yeah. So this, you see, this is about the size of about maybe about 2 meters. So it makes sense, right? So that's very good. And it's the only thing is you don't want to plug in 유리관 into a human neck. That can be very dangerous. So that's invasive. So we want to have a non-invasive. And there's a famous name called the Karatko, who made a auscultation. Very difficult term. 이걸 청진이라 그래요. auscultation of brachial artery. 또 복잡한 말인데 그냥 팔뚝에 있는 동맥을 brachial artery라고 해요. 요즘도 쓴대요. 이 모양을 보세요. 이게 언제예요? 100년 넘었죠. 115년 전을 우리가 지금도 쓰는 거예요. 자, 그래서 blood pressure에 대해서 조금 더 알아보세요. Depends on two main factors. What determines blood pressure? Of course, the heart, cardiac output. So blood volume within confined space, the higher volume means higher pressure. So the more blood volume in the body, the higher the rate of blood returning to the heart and resulting cardiac output. cardiac output, 심장의 혈류량이라고 생각하면 돼요. Potentially resulting in high arterial pressure. 그리고 두 번째는 resistance. 이게 관이라고 생각하면 관에서 똑같은 플로우를 보낼 때 벽이 스무드할 때랑 벽이 우둘투둘해서 저항이 높으면 이거를 플로우를 보내기 힘들죠. 그래서 resistance가 중요합니다. The higher the resistance, the higher the arterial pressure. Okay. There's a precise mathematical descriptions for this, but for this introduction, I just want to give you a general concept. Okay. Resistance depends on vessel diameter, blood viscosity, smoothness of the blood vessel wall. I guess it all makes sense to you. Viscosity, 혈액이 끈적끈적한 사람은 resistance가 높겠죠. 그래서 뭐 사람들은 blood thinner, 뭐 피를 맑게 해주는 약이라고 말하는데 실제로 viscosity가 차이가 납니다. Okay. Invasive, non-invasive. Definition is non-invasive means you don't penetrate the tissue or you 째거나 뚫거나 하지 않는 거예요. Invasive는 entry of the needle or catheter. This is very important term for you to know. Catheter is a hollow tube. Okay, you will see what this is later on, or other instruments into the part of the body. So let's go to how to measure our blood pressure. We use arm, and there are interesting 동맥, artery, brachial, 상완 동맥, and radial. I forgot what in Korean, but it's radial 동맥. This is the most important measure site, and it's close enough to heart and very convenient. So 여기서 제가 하나 설명을 드리고자 하는 거는 플로우에 있어서 층류와 난류가 있어요. 부드럽게 흘러가서 이 층층이 서로 섞이지 않는 플로우를 층류라고 하고, 만약에 가다가 뭔가 이런 protrusion, 뭔가 장애물이 있어서 플로우가 더 휙 그런데 플로우가 막 섞여 버리는데 문제는 섞이는 게 irregular해요. 시간에 따라 달라. 그래서 뭐가 생기냐면 소리가 생겨. 자동차 타고 더 빨리 달리면 자동차에서 소리가 나죠. 그때 난류로 변하는 순간이에요. 난류가 되면 소위 eddy라고 해서 휙 빙글빙글 섞이면서 시간에 따라 막 달라져요. 플로우가. 섞이는 데는 좋아. 하지만 그 난류가 되면 소리 에너지로 튀어나와. 그래서 저항이 높아지고 우리가 차에서 기름을 많이 먹게 되죠. So this exact mechanism can be used for our blood pressure measurement. Let me show how to measure blood pressure. You have cuff, and then you have a measurement of pressure gauge, and you want to listen this sound by using 청진기 stethoscope. Okay. How does it look like? You may have seen in the hospital. This is precise way than the automatic machine, which is in our 학생회관. So this is called sphygmomanometer. This is so difficult term. So I put some of the clues. Sphygmomo means pulse. 매갑계. So it measures pulse. And manometer is measuring pressure, okay, manometer, okay. And the other thing is you want to listen the sound of the flow. So by using this stethoscope, in Korean, 청진기. It's so difficult, but you have to memorize at least once. Stetho means breast, look at. So maybe in the past you use this one to maybe look at or listen breast. That's the origin of the word. But I want to go back to China. You know, like 한의사 can 맥진. They can measure your pulse. This is very fun. Like your left hand and the 엄지손가락 쪽에 여기 힘줄 옆에 이렇게 딱 눌러보세요. 그럼 펄스가 느껴질 거예요. This is a 엄지손가락 쪽에 누르면 펄스. So very good 한의사 can feel this and can know that you have a problem in your heart because they can measure the pulse rate and the impulse strength of the pulse. All this one is called palpation. Palpation 촉진법, okay? So palpation, ancient China, you know, 명인은 they can know this with a lot of training. But now in this area, 명의 is disappearing, I guess. And so what we do, instead we use a technology and instrument to use this. 잘 보세요. 이거는 우리말로 설명하기 어려운 개념이세요. 이거를 여러분들 팔을 꽉 쬐요. 프레셔 올려서. 이거는 기계로 해보면 똑같아. 꽉 쬐서 막으면 동맥이 막히죠. 그러면 소리가 들려 안 들려? 안 들리죠. 그 다음에 천천히 이걸 풀어줘. 프레셔를. 그러면 어떻게 돼? 이게 볼록볼록 되죠. 그러면 어떻게 돼? 난류가 생겨. 난류가 생기면 플로우가 이렇게 펄스에 따라서 그러면 소리가 들리죠. 그리고 이거를 fully 오픈해. 프레셔를 안 줘. 그러면 이게 완전히 열리면 깨끗한 동맥에 흐름이 부드럽게 흘러가니까 소리가 다시 안 들려요. 바로 이 원리를 이용하는 것이 auscultation, 청진, the act of listening the tone either directly or through a stethoscope. 청진기로 이걸 딱 대고 들으면 훨씬 잘 들리니까 쓰는 거예요. 간호사들이 주로 쓰죠. To sounds within the body and based on the pulse wave with the first propagation through the brachial artery, this pulse generate 발명자의 이름을 따라 carotid cough sound. 그래서 병원에 가서 여러분들이 앉아가지고 들으면 간호사가 여기다가 청진기를 대고 그 수은계가 쫙 올라갔다가 쫙 내려갈 때 그걸 보잖아요. 뭘 보고 있는가 하면 저 프레셔가 내려갈 때 부드럽게 내려가다가 내려갈 때 귀로 듣다가 갑자기 소리가 들려. 요 레인지 가면 난류가 돼서 소리가 들리면 그때 딱 체크해 적어요. 기억하고 내려가다가 너무 프레셔가 낮아지면 이제 풀리 오픈되니까 펄스가 안 들려. 그때 체크해. 그럼 120, 80이라고 적어주는 거예요. 이게 그래도 정밀한데 감각이 좀 둔감한 사람이 이거 아무리 들어도 이해가 안 되기도 해요. 그래서 우리는 기계를 더 정밀하게 쓰기도 하죠. Carotid cough sound, pulse wave from brachial artery can be heard when external pressure below systolic or above diastolic. 이때 핏줄이 볼록하게 눌려있기 때문에 난류가 생기고 carotid cough sound가 들리는 거고 그 사운드 레인지에 따라서 우리는 maximum and minimum pressure를 측정할 수 있는 겁니다. 뭐가 단점이냐? 사람마다 달라. 시간도 걸려. 큰 문제죠. 그래서 여러분들 이런 걸 만드는 거예요. oscillometric method라고 하고 이거는 그냥 자동으로 하는 거예요. 자동으로 쫙 프레셔 올렸다가 내리다가 아까 들었듯이 그 펄세이션이 되는 그거를 센서로 딱 측정만 하면은 그 펄세이션 듣다가 사라지면 수학적인 계산을 통해 가지고 요 정도에서 요게 시스톨릭이다. 요 정도에서 오실로메트릭 다이스톨릭이라고 데이터를 모으고 캘리브레이션하고 정해주는 거예요. 단점은 아주 정확하진 않다. 하지만 싸고 저렴해서 학교에 있지만 먼 훗날은 분명히 이게 각 집에 하나씩 들어갈 거다. 왜? 저렴해지니까. Okay, oscillometric method is based on oscillations of blood flow during the pulsation. Using sphygmomanometer cuff. 이거 like the auscultatory method but with pressure sensor. 센서가 있어요. 이 센서는 뭐냐? pressure wave를 전기로 변환해서 우리가 읽는 거죠. 한 에너지가 다른 에너지로 변환되는 게 만들어주는 걸 우리는 transduce라고 해요. To observe cup pressure oscillation. So pressure sensors within the inflated cup. 속에 있는 거예요, 센서가. 하고 요 속에 있는 거고, detects pulsation of the artery wall as a pressure vibration, and the amplitude provides blood pressure value. What's good and bad? Simple, reliable, can be used in the case of hypotension and infant. 뭐 저혈압일 때도 쓸 수 있고 좋죠. 저혈압이면 원래 사람이 들어서 하는 건 너무 저혈압이면 잘 안 들려서 잘 안 되는 건데 센서는 상당히 민감하니까 대신 사람이 직접 넣고 하면 모션 아티팩트가 생길 수 있고 그렇습니다. 자, okay. So this is the actually last slide. So before last slide, I want to get more questions. So I have some time. I'll give you 1 minute. You can write down your questions so that I can spend time to answer your questions before I cover the last slide. Okay. 여기 해도 되고 아니면 말로 해도 되는데 아마 저기 채팅으로 치는 거를 조금 더 편하게 생각하실 것 같아서. 자, 질문 지금 적어도 괜찮아요? 아니면 궁금한 거 아무거나 적어도 돼. 질문 없어요? 지금 전화도 되는데. Okay. You can write down anytime. Okay. Then I will go back to answer your question. So let me go over the last slide. 자, 이거는 우리말로 할게요. 이거는 히스토리를 좀 이야기해야 되는데 제가 그 여러분들의 선배님들을 데리고 수업을 했어요. 서로 다른 실험실 학생들, 다른 전공이 모여서 새로운 걸 만들어 보자. 의료기기랑 관계된 거를. 그래서 두 학생이 모였어요. 한 명은 MEMS라는 Micro Electromechanical Systems라고 하는 기전공학부에서 MEMS를 전공하는 학생이고 한 명은 전작과에서 광5를 전공하는 학생이에요. 모여서 우리가 이걸 합쳐가지고 뭔가 압력계를 만들어 보면 어떨까? 어떤 압력계냐면 tiny. like 이거보다 훨씬 얇고 해서 아주 조그마한 혈관 같은 데서 들어가서도 압력을 측정할 수 있는 걸 만들어 보자. 그래서 여기 보면 extravascular pressure measurement라고 해서 요게 200 마이크로미터예요. 그럼 직경이 200 마이크로미터면 여러분들 머리카락이 about 100 마이크론이에요. 요 두께가 머리카락 하나 또는 2개 정도 두께라고 생각하면 돼요. 거기다가 그 유리를 끝을 약간 불로 지져가지고 동그랗게 만들어. 그러면 렌즈가 되죠. 이렇게. 그리고 멘즈를 전공하는 친구가 요 앞에다가 작은 막을 만들었어. 막을 만들어서 빛을 보내면 원래 빛이라는 거는 또는 어떤 웨이브든 한 매질에서 다른 매질을 가면 칵 받고 튕겨 나오는 게 있고 또 트랜스미션 전달되는 게 있죠. 그렇게 전달됐다가 또 막이 있으니까 거기 가서 또 맞고 되돌아오면 요 두 개가 되돌아오는 게 광학적으로 간섭을 일으키고 그 간섭은 요 두 개 사이의 거리에 따라서 관련을 하니까 아주 작은 거리의 변화도 잠시만요. 한 명. 가장 작은 변화, 우리는 지금 빛을 이야기하니까 빛의 파장은 수백 나노미터예요. 그래서 수백 나노 또는 수십 나노미터의 차이가 실제 이 다이애프람에 변화를 주고 이 다이애프람 변화는 실제 압력이 이 다이애프람을 이렇게 왔다 갔다 미는 거니까 요거를 간섭계, 광학 간섭계를 만들어 측정하면은 그러면 아주 작은 압력을 재는 게 될 수 있겠다 해가지고 이게 디자인이고 이게 실제 만들어 놓은 거고 개념은 여기다가 뭐 일렉트릭 차지를 하니까 이게 두 개를 붙일 수 있고 이거는 동그랗게 렌즈 모양으로 만들 수 있고 앞에다가는 램즈로 뭐 PDM에서 그냥 플렉서블 플라스틱이거든요. 그걸 붙여가지고 게다가 여기 코팅도 하고 글라스로 만들어서 이걸 실제로 특허 출원도 하고 논문도 쓰고 그런 예가 되는 겁니다. 그래서 여러분들의 어떤 엔지니어링 또는 사이언스 이런 개념들 여러분이 배우고 넓게 배우고 하는 것들이 어떤 아주 타이니한 옵티컬 압력 센서를 만들어서 어떤 환자들은 굉장히 작은 블러드 베슬에서 압력을 직접 측정해야 될 수도 있고 또는 브레인에 데미지를 입으면 이게 뇌압은 두개골 때문에 올라가면 큰일 나거든요. 바로 뇌사 상태 또는 의식을 잃게 되기 때문에 그런데 꽂아서 뇌압이 어떻게 되는지를 측정할 수 있거나 그런 데 활용될 수가 있죠. Okay, let me go back to any questions for you. Okay, okay, there's no more question. So, okay, so I think we have about 3 minutes. Let me go over a little bit nomenclature. So the most important thing in this biomedical engineering is first, you have to get familiarize yourself with the nomenclature. These days, these are mostly like Greek or Roman or French, very, very difficult Latin origin. So you have to get familiarized with the term. Otherwise, you cannot communicate with clinicians. And medical engineering means you're working for some products for patient healthcare, and that has to be through physician or doctors, and you have to know the language. So that's why this is important. And actually it's fun. Encephalopathy, encephal, 뇌, apathy, 아픈 거, so 뇌증, or 병리라고 그래. retinopathy, 망막이 아픈 거. conversion, 경련, cardiomyopathy, 심장의 근육이 아픈 거, 또는 myocardiopathy, different ways, nephropathy, nephro가 심장이거든요, 콩팥, nephro가 아파서, myocardial infarction, 근육, 심장, myocardial infarction, infarction은 경색인데 피가 막혀서 그 조직이 죽고 스카링이 되고 하는 현상을 infarction이라고 말해요. MI라고 메디칼에서는 하죠. hypertension, hypotension, angina. angina 코끼리가 가슴을 짓누르는 같은 그런 느낌. 어머니들, 할머니들, 할아버지들 협심증 걸렸다 그러면 이걸 의미하는 거예요. 이게 바로 심장마비의 전초전이기 때문에 그때부터는 혈압약을 복용하고 블러드 thinnер 또는 아스피린 같이 블러드를 이런 응고가 잘 안 되는 거를 써서 이런 심장마비를 예방합니다. 저희 어머니도 이런 걸 드시고 계세요. auscultation, 청진, sphygmomanometer, 내갑계, 혈압계, 스테토스코프, 청진기, arteriosclerosis, 동맥이 경화되는데 그 중에 플레이그가 생겨가지고 더 위험해지는 그 부위를 우리는 atherosclerosis라고 말합니다. brachial artery. Okay, so today we discuss about circulatory system and blood pressure. This is one of the most important in medical aspects. But next time we will discuss about device of pulse oximeter, blood chemistry, glucometer, Doppler blood flow. Okay, I think this is good time to finish, and thank you everyone.